Hi everyone, thanks so much for joining. Today we're going to be looking at electronic medical records. We're going to be looking at a brief overview of what they are and a little bit of how they pertain to the medical industry. Let's just take a look at an introduction to electronic medical records, or what's better known as EMRs. First of all, why do we need electronic medical records? Why would you need them? So the answer is because there are a lot of problems with the current healthcare system. To itemize the problems, let's go like this. Research shows that roughly 30% of children receive excessive antibiotics for otitis. 20 to 50% of surgical procedures aren't necessary. 50% of back pain x-rays aren't necessary. And 50% of elder patients don't get Pneumovax. Okay, these are serious medical errors that exist, the research shows exists in the overall medical industry today. Now, clinical practices are a data-intensive operation. And many times inadequate data communications cause significant medical errors. Now, today for data communication, we typically rely on human cognition. We typically rely on the doctors, on the doctor's perception of the situation, the doctor's his handwritten records, and his assessment and whatnot. Now, human cognition is good at pattern recognition, right? In other words, a doctor might be able to recognize a pattern, but it's very limited. Human cognition is very limited when it comes to remembering lists or evaluating multiple business rules. Now, electronic medical records are available 24/7. They can be viewed by more than one user at a time. The records are available from remote locations. This might be for covering MDs, and this might be for anybody else with appropriate needs to access the data. The data can nearly always be found, and it's legible. EMRs enhance communication from a lot of different angles. First of all, it enhances communication between different medical providers and clinical messaging. It can tag an EMR location with a message. And it assists in communication for referrals. To zero in on this, half of specialists that received referrals, a lot of times didn't even know what the main question was. And a third of the time, the patients were referred to specialists. No information came back from the specialist to the PCP. Another reason why a lot of people are switching over to electronic medical records are for cost savings. Okay, there are dictation cost savings, which are estimated at roughly $170 for a full-time employee per month. Then medical organizations save on the chart pull costs, which typically come out to about $217 per full-time employee a month. Now, the savings will accrue to the medical practice and will wind up applying to all payers. Now why do we need EMRs? So EMRs assist with decision support, okay, in many domains. Okay, it assists in cost and selection of drugs. Research found that there was typically an 18% reduction in costs for drugs when they were selected by EMRs. Another area of cost reduction was in the cost for lab tests. Research found 10 to 15% reduction in costs for charges, last result, and probability of abnormal. In addition, it helps with the cost and selection of radiological studies. Now, another angle of electronic medical records is decision support. Another area is that by inpatients, computerizing ordering decreased A, serious medication errors by 55%, and B, all medication errors, overall medication errors, by 81%. Now, the way EMRs do this is by structuring medication orders. In contrast to paper orders, there was a 34% error rate versus a 6% error rate with electronic orders. We also have alerts. The EMRs will typically alert the physician about allergies, duplicate medications, and many other issues. Now, the question always is, do EMRs actually make a difference? Okay, so the answer is yes. The answer is unequivocally yes. But the thing is that they cost. Okay. Now, how do they make that difference? So there were a lot of studies done on EMRs, and they've consistently showed that with the use of an EMR, a patient will shorten the length of stay in a hospital setting. There will be a significant decrease in adverse drug events. There will be an improvement in readability, consistency, and content of the medical records. They've consistently shown to improve continuity of care. And they've consistently reduced practice variation. Now, the bulk of these benefits come from decision support. Now, let's take a look at electronic medical records use in the United States. Okay? Even though the American healthcare system is the costliest in the world, The funny thing is that its performance ranks 37th, according to the World Health Organization. Perhaps we can pinpoint that studies have shown that only 5% of US PCPs use EMRs. Seven percent of all physicians use EMRs. That's a drastically low number. Now, perhaps we can attribute the lagging performance of the U.S. healthcare system to the lagging rate of adoption of electronic medical records.